Parents of children with peanut allergies take every precaution to keep their kids safe. And while peanuts are one of the most common food allergies among kids, there are a number of other foods that children can be allergic to as well.
Yes, pediatrician Dr. Dina Kulik joins us now to talk about some of the other less common food allergies and common misconceptions we've got about food allergies in children. Doctor, good morning.
Thank you very much. Thanks for having me.
Good morning. It's amazing when you have kids how you suddenly have to be, up on all of the latest medical science and things. When my kids were born, they said wait until almost 2 years to give them anything that might be allergenic. Now, you should do it right away.
For sure. So not right away, but early on in the introduction of food. So somewhere between 4 and 6 months is a really nice hot spot where you can introduce solids, introduce allergenic foods, and therefore decrease the risk of allergies.
Okay, and I remember also when I took my first in to get vaccinated, I was asked, does he have an egg allergy? Because that was in the vaccination.
So now it's only in the flu vaccine, actually, and even kids and adults that have allergies to eggs can still get the flu vaccine safely. It's not a risk. You just wait 10 or 15 minutes in the office just to make sure. But the governing bodies of immunizations do suggest to get it even if you're egg allergic.
Yeah, of course, as we mentioned off the top, we all know about peanut allergies, and we're talking about eggs as well. Is there other things that parents need to know of or be aware of?
To introduce them early, really. So that's the big key. When I was a kid, when you guys were raising your children, you might have been told to wait longer, wait after a year to introduce the allergenic foods like wheat and different kinds of nuts and eggs and fish. And now the really overarching body of evidence and literature suggests that introducing them earlier, again around 6 months of age, will actually decrease the risk as opposed to increasing the risk. So introduce them earlier and enjoy those foods.
Because my kids are both older now, but when they were little, I did actually, when I finally introduced peanut butter to my son at age 2, he had a terrible reaction and is in fact allergic. Everything else was fine. But so now let's say you have an infant at home, you scramble up some eggs. Can you use the whites and the yolk with a little person?
Absolutely. So you can introduce them together. The whole egg is just fine. If you're going to be allergic to eggs, you'll probably react to either part anyway, and it won't change much whether you introduce them at 4 months, 6 months, 8 months,
and how much of anything? Peanut butter, eggs, what else do we have here?
So wheat, fish would be the other one, seafood. Introducing those early is a good idea.
And would it be just a tiny amount?
We actually don't know. We don't know if you need a tiny amount versus a larger amount. We just know overall introduction early on is a good thing.
Yeah. Is this more prevalent today, or are we just more aware? Because it seems, when I was growing up, when we were all growing up, you rarely, if ever, heard of food allergies. Now they seem to be everywhere.
That's it. So there is an increased risk of allergies over time. We've seen that, and that might be maybe because we are delaying the introduction. So that's part of the recommendation.
It's a scary business.
It is.
When
Allergies are terrifying. Yeah.
Yeah, it really can be. And so if you introduce the food, what kind of reaction should you expect if there is some sort of allergy, and what should you do?
Right. Excellent question. So typically what we see is a rash around the mouth. You could have a full body rash, but typically on first intro or second or third early on, if a child's going to be anaphylactic or allergic, they might have a rash around their mouth, and then a rash around the body ongoingly, and other things like vomiting, diarrhea, belly pain, difficulty breathing, coughing, choking. Those are things that we think about in allergic reaction pieces. If your child just has a rash, call your doctor, take some Benadryl, don't introduce the food again, wait it out, see your doctor, get some allergy testing. But if there's anything other than just rash, like I mentioned, vomiting, diarrhea, any of these other things in addition, you want to call 911, you need to get epinephrine or adrenaline.
All right, good advice for parents everywhere. Dr. Dina Kulik, good to see you. Thanks for coming in this morning.
Thanks for coming in. We're going to take a break on this Tuesday morning, November the 10th.